Hello everyone. This is a case of 40 years Paravan post-menstrual spotting with refractory to the hormone for last 1 year. So she has in the ultrasonography in the lower part there was an ill-defined area, hyperechoic area. So we planned for the hysteroscopy, and in the hysteroscopy we found a polyp, a nice polyp in the lower left part of the uterus. So the message is that whenever there is irregular bleeding, particularly refractory to the hormone, and particularly post-menstrual spotting or intermenstrual spotting is there, definitely there is a place for the hysteroscopy. Of course, we must analyze the uterine cavity through the ultrasonography, particularly TVS, or if possible, the 3D rendering of to visualize exactly the uterine cavity. Thereby, we can recognize the pathology. Even we can go for the MRI if we are not going for the hysteroscopy to diagnose. We can go for the MRI to pinpoint the diagnosis. So, the message is that we must not neglect the case and over lingering the case with the hormone therapy. There are multiple hormone therapy this patient had received for last 1 year with multiple consultants, and this was subjected for the hysteroscopy and resection by the cold seizures, then followed by completeness is checked, and the thorough curettage was done, followed by the no hormone therapy will be subjected. Another case of 39 years prior to with heavy bleeding PV, and she was for hormone for last 6 months by the different consultant. And now with the ultrasonography we noticed that there is isolated thickening area. So the ultrasound provided to us was the thickened endometrium of 14 mm. But when we examined with the ultrasonography, there was isolated thickening of the endometrium. That is most important. And for this type of the cases where the menorrhagia is there, post-menstrual evaluation of the endometrium is most important. If it is more than 12 mm or 14 mm, we must subject the patient for the hysteroscopy. And in the hysteroscopy, there is a polyp. This is an infected polyp, a fragmented polyp, and this polyp is arising from the posterior wall. And we have removed the polyp through the ovum forceps. There is a small ovum forceps are there. The biggest advantage of the hysteroscopy is that we can target that area and we can remove the polyp, followed by completeness is checked. Thank you all.